There's no single test used to diagnose prostate cancer. Prostate cancer diagnosis involves several tests. Some are carried out by your GP, and if needed, further testing will take place at the hospital. There are a few tests that your GP may do to find out if you might have a prostate problem. These include a urine test, a prostate-specific antigen or PSA blood test, and sometimes a digital rectal examination. Your GP may ask you for a urine sample to test to see if you have any other health problems, such as diabetes, kidney problems, or an infection. The PSA test measures the amount of prostate-specific antigen in your blood. PSA is a protein. It's produced by normal cells in your prostate and also by prostate cancer cells. We have more information about the PSA blood test on our website. A digital rectal examination, also known as a DRE, is where the doctor feels the prostate through the wall of the back passage, the rectum. Your prostate may feel a normal size for your age with a smooth surface. It may feel enlarged. An enlarged prostate is a common non-cancerous condition in older men. Or it might feel hard or have a lump or feel lumpy. This could be the sign of prostate cancer. You don't have to have a DRE. You can make the decision to have a PSA test alone. Your GP will talk to you about all the test results and what they might mean. If your GP thinks you may need further tests for prostate cancer, they will refer you to see a specialist at the hospital. If you're referred to the hospital for further tests, you will see a urologist. They will look at the results of your tests, your risk of prostate cancer, and your general health. They might recommend another PSA test at your GP surgery in the future, or they might recommend an MRI scan. An MRI scan uses magnets to create detailed pictures of your prostate and the surrounding tissue. The images of your prostate produced by the MRI are used to tell your doctor how likely it is that you have prostate cancer. Depending on the results of your MRI scan, you may require a prostate biopsy. This involves using thin needles to take small samples of tissue from the prostate. There are two main types of prostate biopsy: a transrectal biopsy or a transperineal biopsy. The biopsy samples are looked at under a microscope to check for any prostate cancer cells. Your doctor will be sent a report which will show whether any cancer was found. And if cancer was found, it will show the grade of the cancer. This tells us how aggressive the cancer is, or in other words, how likely it is to spread. Your MRI and further scans can be used to work out the stage of the cancer. It may be localized, locally advanced, or advanced prostate cancer. If no cancer was found, your doctor will discuss with you what to do next. Based on your results, you and your doctor will talk about the next best step for you. Treatment options depend on the stage and the grade of the cancer. If you have localized cancer, you might be able to have your cancer monitored with regular checkups or treatments aiming to cure the cancer. If you have locally advanced prostate cancer, you might have treatment aiming to cure the cancer or to keep it under control. If you have advanced prostate cancer, treatments aim to shrink the cancer and keep it under control, and to manage any symptoms. You can find out more about your test results and treatment options on our website, prostatecanceruk.org. Or you can speak to our specialist nurses on 0800 074 8383.